Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hello, my name is Monica Adams. I'm a volunteer with the Disability Advisory Council at Northwest Senior and Disability Services. Today I'm here interviewing Paul Evans, who's the incumbent and Democratic candidate for Oregon House District 20. Paul, thank you so much for being here and sharing your time.
Thank you for the opportunity to be here.
Absolutely. So to get us started, can you tell us a little bit about the votes and legislations you've supported in the last session that have benefited seniors and people with disabilities?
Sure. Over the last several years, we've been working on a number of issues that affect every Oregonian, emergency management reform and other major scale activities to try to help the state as a whole. But in specific to issues that I know are very important to the constituency that's tuning in today, we worked on Future Ready Oregon, which is a workforce development bill that also has a focus of $200 million in improving and expanding workforce for the healthcare sector, which is very important, as we know right now that a lot of folks need services and help and support that they can't get. We expanded access to portable cooling units, truth in advertising. That one hasn't been executed as well as we hoped it would be, but we're trying to get that done. That was Senate Bill 1536. We updated manufacturing housing law to make sure that places were safer, especially for senior and elderly who sometimes can't get the support for remodel, et cetera. We expanded broadband access so that seniors that are homebound have better access to the outside world through the internet. And we've, of course, continued to push for increased funding for Oregon Project Independence. Those are some of the specifics. But again, I think that the investments that we've made as a state, the efforts to try to keep the economy going, and the efforts to ensure that the ARPA money was spent wisely, all combined to be able to say that we've done our very best to be good stewards for the folks who are dependent upon the services you provide.
It's awesome to hear that so much work has been going on. Can you expand a little bit on how you've advocated for Oregon Project Independence?
Well, since I first got into the legislature in 2015, Oregon Project Independence has been one of those programs that just make sense. Keeping people at home, providing the skills and the training so the folks can help keep people at home is not only the most efficient and most affordable method long term, but it is in fact, I think, the most moral thing to do. It allows people to have control over the years where, unfortunately, in some other countries, people don't have such controls. And what we have done, quite frankly, is make sure that the folks in leadership, the advocacy groups, the folks on the Ways and Means, which I now serve on and have for the last 2 years, recognize the importance of the project and that gets funded. It has never gotten funded at the level we would hope, but it has gotten funded at the level that we could afford. And for me, it's a matter of honor. We're going to continue to try to do that.
So looking at funding going forward, how do you prioritize funding for services to a population of seniors and people with disabilities that is expanding?
So how do we prioritize? I think, to me, it goes back to what government exists to do, and that is to provide protection for those who can't really do certain things for themselves anymore. Government isn't the answer to every problem, but government is in fact supposed to provide safeguards. It is supposed to provide a community expression of helping people as they transition through various chapters of their lives, especially with seniors and folks who have special needs. I prioritize that group of people at the top of the list, just as I do children. They're folks who are at the other end of the spectrum, where absent our assistance, they're not going to be able to provide for themselves in some cases. They're not going to be able to live a dignified life. So my view as a person of faith and as a person who tries to do the very best to steward the resources I have is that it's a matter of dignity. And I don't think you can put a price on that. So in terms of priority, to me, it's just keeping faith with our responsibilities as members of a society to make sure that the folks who need our assistance in older age, who need our assistance because of special circumstances, children, and those who, but for a couple of, helpful hands, wouldn't really be around. So to me, this group and the services that they provide is critical.
Thank you. That's good to hear. It's nice to hear the focus on our more vulnerable populations. So kind of thinking about some of the specific challenges we see with this population, what is your plan on a state level to ensure that seniors and people with disabilities have continued and increased access to affordable housing and appropriate nutrition?
So I think that there's a number of ways to approach this, and I want to be very clear. As a legislator, we generally focus on certain areas where we become subject matter experts. I am not a subject matter expert on housing. I'm not a subject matter expert on food banks. That said, I do believe that there are certain activities that government functions, certain things that we do that we could be a little more focused and purposeful about. So here's what I mean. We could, and I believe we should, tie development of housing into ensuring that there are transportation and other food and nutrition activities related in that same cluster of development. I happen to believe that community gardens, community orchards, especially when tied into schools, could provide a significant increase in at least healthy vegetables and healthy foods for folks. In fact, we introduced a bill over several sessions ago that would have provided a tax credit to people that provide their front yard to basically be a community garden. In the Willamette Valley, instead of growing grass that we can't really water because of responsibilities, let's grow some food that we can actually use to make sure that folks, A, learn how to grow food as an educational component, but B, that the byproduct of that is to help our food banks have much more nutritious, much more locally sourced vegetables. I also think when it comes to housing, we can do things in terms of requirements of construction that provide for revenue streams that could be used to subsidize the cost of housing for most vulnerable folks. We have the unique situation right now where through certain types of net metering and other types of practices, we could encourage larger scale solar and wind generation and basically use some of the profits from that to help offset the costs of rent for a certain number of folks in each development. The other thing we can do is start rethinking about how we actually look at where we put housing in terms of density. In a lot of rural communities, we could rethink the downtown and actually provide a second or third floor, obviously with elevator access and all the things that are necessary, but to use our space more effectively in areas where there's also a desire to do some commercial investments. So I want to be very clear. I'm open to any idea that will actually move us forward in a responsible manner. I'm not wed to any one specific approach. I think the state of Oregon has made significant investments in housing and rental support over the last 3 or 4 years. We have more work to do, and I hope I get the opportunity to continue the work.
Thank you. That's good to hear. So kind of a final question, looking at the current context we live in, there's a lot of challenges to behavioral health.
Yes.
What are you planning to do as a legislator to address the behavioral health issues and needs that have been exacerbated by isolation related to the pandemic?
Well, I think that when you're looking at behavioral needs, behavioral challenges, mental health care challenges, addiction services, it is a very complicated process where there's no one answer. And having said that, that doesn't mean that because it's so big, we don't have a responsibility to act. To me, it means we have a responsibility to measure once or twice before we take an action. This last legislative session, Representative Rob Noss and others, but he was really the leader of it, put a whole lot of investment into behavioral and mental health care. There are a number of programs associated with Measure 110, as well as some other programs that had predated that measure that started to provide, I think, the kinds of outcomes that we were looking for through pilot programs. So what I intend to do as a legislator, if given another term, is to support the efforts that have data-driven results, make sure that we have conversations about how we can link programs that help folks get healthier and well to programs that help get healthier and well people to that secondary temporary living facility beyond just getting initially healthy, getting them into jobs that are more sustainable. And then recognizing that through any number of ways that we have put into place, we can actually, over a 3 or 4 or 5 year program, try to get folks from where they started out in a very bad place to at least a more sustainable place that, oh, by the way, provides them an opportunity to help somebody else as well. So what my role is going to be is to basically support the folks who are the certified smart people on these particular issues and to fight for funds for Polk and Marion County for programs that link what I believe the learn and live environment for folks who have been assisted, who are trying to reintegrate into the society, who are prepared for larger challenges, but getting them into programs and processes where they actually not only get to succeed, but where they can actually help others along the way as well. I believe that approach that is much more community-based, where people are helping each other, really is the key to a long-term success. And I hope to continue to be in the legislature to be able to support those programming and those funding requests.
Absolutely. It's good to hear. Thank you. So I think we're coming to the end of our time. Paul, thank you so much for taking the time to answer all our questions today. We really appreciate it. And to everyone watching, thank you for joining us today for this interview with Paul Evans, who's the incumbent and Democratic candidate for Oregon House District 20.
Thank you very much for the opportunity, and have a great rest of your summer and fall.
You too.
Bye-bye.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.